Mr. Speaker, point of personal privilege.
Gentleman may proceed.
Mr. Speaker and ladies and gentlemen of the House, I didn't know I was going to follow the gentleman from Brico, but it's an opportune time. One of the things as the Vice Chairman of the Medicaid Innovation Reform Commission I thought I would do, since we have had a meeting, and by the way, the House members have been willing to meet. The Chairman of the Merck Commission is a senator. The first meeting he called was the meeting we had yesterday. We were more than happy to meet at any time, and in fact, the members of the House had talked about having a meeting earlier, and in fact, we discussed about having a meeting during the session, but that did not occur. Mr. Speaker, this afternoon, I wanted to just give the House an update on where we are with the Medicaid Innovation Reform Commission and talk about the meeting yesterday and the members of the Merck Commission that went through 5 hours of testimony and information yesterday. This will be a repeat for you all, so I apologize for that. I have to give credit to Delegate Brink. I saw him there, and he sat through most of the discussions and the meeting, and so it will be a repeat for him as well. But first of all, Mr. Speaker, I want to talk about what the House members went into the meeting with. We knew what the agenda was going to be. We knew what questions we thought we might have. And we did have lots of questions. I think if you talk to members of the press or any other individual that was there, you would find that we were engaged and were willing to ask questions. The problem we encountered, though, I think from our Senate colleagues and some of the presenters, was that we got an answer most often that they continually said, we don't know because the legislature hasn't passed it yet, related to a plan. Well, Mr. Speaker, it struck me when that was repeated several times in that I recall back when the Affordable Care Act was being debated, then Speaker Pelosi said that we'll read it after it's been passed. Well, as you all know, we don't handle legislation that way in the General Assembly. We like to read things, we like to question them, we like to consider them before we actually vote on them. And luckily, this isn't Congress, this is the Virginia General Assembly. And that's why we did take time to ask many questions, and more often than not, that's why when we move legislation forward, we consider it carefully. Now let me talk a little bit about the Marketplace Virginia plan that the Senate has put forward and the questions we asked related to that. Marketplace Virginia, and the questions we were able to ask and the information we were able to receive, is nothing more than Medicaid expansion. It's been nuanced by individuals, including the chairman, co-chairman of the Senate Finance Committee and the senators. And they're trying to draw a distinct distinction between Medicaid expansion and Marketplace Virginia. But in fact, based on the information we got yesterday, I would consider Marketplace Virginia Medicaid expansion just by another name. It uses Medicaid dollars to cover Medicaid eligible the population through the same type of managed care delivery system that we use currently for Medicaid. And our federal government explicitly says that these are Medicaid beneficiaries as part of the plan. Marketplace Virginia also costs the same as Medicaid expansion and uses the same Medicaid matching rates. Now, one of the things I knew growing up, I never hunted duck, but I know a little bit about ducks and the folks that hunt ducks. When it looks like a duck, it walks like a duck, and when it talks like a duck, it's a duck. And Marketplace Virginia is Medicaid expansion. Now let me talk about the concerns we had related to how their plan would work, Marketplace Virginia, and why we think it's flawed and unworkable. It would require a temporary 3-year waiver, according to our Senate colleagues. We would have to enter into negotiations with the federal government. The federal government would have to approve everything, and based on what we found from other plans that other states have submitted for waivers, it really would not provide any flexibility. And more importantly, what would happen when the waiver goes away? We would have Medicaid expansion because we would be tied into the program and then we would have to continue to fund it. Now, there are key provisions that they have in the plan that they really are touting on the Senate Marketplace Virginia plan, but we know that those provisions have not been approved in other states' requests through the CMS. The opt-out clause that the Senate is touting in Marketplace Virginia, we have found that Arkansas was told that they would have to wait 7 months and give everyone the right of appeal. That's not an opt-out provision. That's a delayed provision. The cost-sharing aspect that we actually are very interested in. The House members have talked about that in trying to get, if you will, a compromise related to our current Medicaid population. If we could have a cost-sharing provision, that would be very much supported from the House standpoint. In a memo to CMS, that was explicitly said, they explicitly said that the cost sharing cannot exceed the current Medicaid program. And in fact, Michigan's cost sharing program was deemed to be unenforceable, meaning that you cannot do anything if someone does not pay their copay. Well, if you're going to have someone participate in the plan, just like we do in our private plans, and you're going to have skin in the game, as the Senate called it, would you want to have a requirement that you can't just pull out when you want to, or it'd be optional? But that's what the CMS has approved, and unfortunately that cost-sharing provision that we would support has not been approved in any other state. The other is the work search. We had a lot of discussion on that. Unfortunately, no state has been approved for a work search requirement. Pennsylvania recently withdrew their request for a work search requirement because CMS wouldn't even consider it. The Pennsylvania governor, I believe he's a Democrat, Tom Corbett, said there is no middle ground with CMS. Maybe he's not. But the problem, again, is that the cost sharing, the opt-out, and the work search requirements that we would very much like to see, no states have approved or had their waivers approved through CMS to allow that. And that's an integral part of what the Senate has talked about in a private sector solution through their Marketplace Virginia plan. Their plan would also require a state exchange. The plan would require Virginia to set up a state exchange like Oregon or Maryland. Let's talk about Maryland first. Maryland spent over $125 million on its exchange. And you probably read, especially those of you that get the Washington Post, not only that they had to basically throw their plan out because it wasn't working and start all over. Oregon spent over $300 million to set up their exchange, and it still doesn't work, and they're looking for special assistance to try to make that plan work. The other problem that we found, and Senator Watkins was a little bit fuzzy on this, but he didn't seem to understand part of the language that was included in his Marketplace Virginia plan, and that is legislative oversight. As you all know, the compromise last year was to set up the Medicaid Innovation Reform Commission to look at reforms and then to consider whether we should expand or not. I'm going to talk about the reforms in just a minute. But under his plan, it gives all the authority to the Secretary of Health and Human Resources. Takes the legislature out. There'd be no legislative oversight. It would also eliminate, he didn't really seem to understand this, all of Merck's authority. It would become an advisory commission. Well, we have a lot of advisory commissions, but the purpose of the Merck was a compromise to give substance to looking at this very important issue. It would remove all that authority and oversight. The other thing I want to talk about related to this, their plan still relies on borrowed federal dollars. In the best case scenario, it would only cost us $200 million. Worst case scenario, it would cost us over $1 billion. And what would happen if that money were to go away? We can't opt out, as I've mentioned. If we can, what happens to the 400,000 people that we potentially, as a maximum, as you all know, anywhere from 230 to 400,000 people that we would enroll under a Medicaid expansion? What would happen to them? We just take the services away from them? I think, it makes very clear that the Marketplace Virginia plan really has few, if no, in my estimation, merits. especially when the best argument for their plan is, well, if it doesn't work, we can just get out of it. That's not a good option. That's not something that we'd like to move forward. We'd like to have things thought out, considered, and to make sure that they're going to work. Now, let me real quickly, Mr. Speaker, before I conclude, talk about the reforms. Secretary Hazel gave us a very fine report. Last time we got a report and we had green lights, yellow lights, and red lights. I like colors, but we had a little disagreement on whether we were at the green stage or the yellow stage or the red stage. In my estimation, the last time at our December meeting, we were at yellow or red for most all the reforms from the standpoint of showing results and showing the benefit to the Commonwealth related to those reforms. The Phase 1 and Phase 2 reforms, DMAS, is making progress, and they're moving forward, and he reported that. The Secretary seems to think that they've been completed. Well, they haven't been completed because some of them, the deadlines don't even, from a timing standpoint, get done until this year or next year. That's not completed. Phase 1 and Phase 2 reforms also, we haven't fully gotten reports on what the results are from a cost savings, from the benefit to the individuals, and those figures keep changing. It's like shifting sand. December, it was one figure. During the session was another, and now we have yet another rendition of these are what the figures are. We also know in Phase 3, which is dealing with our ID and DD waiver populations, those reforms have not even yet begun. They're just groups working together now to put a plan in place to accomplish that. And that will not be done, and those will not be completed till next year or 2016. So reforms are not done. The other thing we learned, Mr. Speaker and ladies and gentlemen of the House, that I want to report to you about is we questioned and got information from a local Department of Social Service agency, the Floyd County Director, and that's a rural area. Departments of social services across the state, according to their report, are behind from the standpoint of the number of individuals they need to currently serve the populations they're dealing with, over 1,000 FTEs across the Commonwealth. I think that's even higher at this point because that was a fairly, I think, old study, maybe 2007 if I recall. So that was one point. I purposely asked the gentleman if he thought if we expanded Medicaid, they were prepared to handle the additional eligibility, signing people up, and have them be able to get the services that they should be able to get to make sure that they're going to get the benefits that they would get. He said they're not prepared. They would need additional resources. They are going to get back to us on what those costs would be for those services that they need to provide. That's a great concern to many of us that don't want to send another unfunded mandate to our local governments. Mr. Speaker and ladies and gentlemen, just to conclude, we are still getting information from the MERC. We will have additional meetings, but our work is not complete. It was set up purposely to look at, in a serious manner, the issues related to reforms and these other issues related to Marketplace Virginia and expansion. As I've said, Marketplace Virginia is simply Medicaid expansion. Our Senate friends like to call it something else, but that's what it is, and we need to call it what it is. Unfortunately, from my standpoint, and I think my colleagues would agree on the MERC from the House, it's flawed, it's unworkable, and it does nothing to fix the system that we already know needs fixing, our Medicaid system. And it relies on borrowed federal dollars. And that argument's been made over time and time again. So, Mr. Speaker and ladies and gentlemen of the House, I hope we will decouple the budget from Medicaid, let the MERC do its work, and then our localities can move forward, the MERC can continue to get information, and that we can work to solve the reform issues related to Medicaid for our system that is 22% of our budget currently. Thank you, Mr. Speaker.